Hi, my name is Connie Laklanis and you're watching the video Third Nerve Palsy, Aberrant Regeneration. In this video, we will briefly discuss the phenomenon known as aberrant regeneration, which occurs in patients who have been diagnosed with a third nerve palsy. Aberrant regeneration is a characteristic pattern of recovery that occurs in some of our patients with third nerve palsies. It doesn't occur in all, it just occurs in some of our patients, but it is typical of a patient recovering from a third nerve palsy. And what it involves is a synkinesis or an oculomotor synkinesis. A synkinesis means that we're getting simultaneous innervation. So we could have, for instance, simultaneous innervation of an extraocular muscle and a lid. Why does aberrant regeneration occur? It is thought that there's a misdirection of the nerves that are healing. So either a mass response of the damaged nerve, which results in a growth of incorrect nerves going into the wrong direction, or abnormal growth of axons, again, misdirected. This will lead to an erroneous co-contraction of muscles. The most common presentations are as follows in this particular slide. So firstly, we have here elevation of the upper lid on down gaze. That simply means what that says, that as the patient looks into down gaze, the affected eye will elevate. If we take a look at the patient here to the right, we can see here that the palpable fissures are relatively similar on the right and the left side in prime position. But as the patient comes into depression, we see that the left eye, which was the one that had the third nerve palsy, elevates. So we have co-contraction here. What we have is that the nerve that was going to the inferior rectus is now also going to the levator, and as the patient tries to depress, there's co-contraction of the two and we get lid elevation and depression of the eye in this particular instance. Okay, another feature we could see is retraction of the upper lid on down gaze and adduction. So here, whilst the eye movement is occurring as the patient is looking into adduction into down gaze, we can see that upper lid retract. We can also see pupil constriction on adduction. So it's not normal to see pupil constriction during ocular movements. We see it on accommodation in terms of when we look from far to near, or we see it as a light response. But now what can happen is you could actually have the pupil constricting on adduction. Again, we're getting co-innervation here to the sphincter pupillae and to the medial rectus. And we can see retraction of the globe in some positions of gaze as well. It's worth noting that aberrant regeneration tends to occur in patients who've had a third nerve palsy that's been caused by trauma, a space-occupying lesion, or conditions such as an aneurysm. What this means is that microvascular lesions don't tend to cause aberrant regeneration. And it's thought to be the case that microvascular events don't cause structural damage to the nerve as compared to trauma or a aneurysm or a tumour compressing on the nerve that can actually cause structure damage. So that's thought to drive the aberrant regeneration. In terms of when might you see aberrant regeneration, it can occur within weeks or months after onset. So once the third nerve palsy has developed, there will begin a regeneration process that may involve aberrant regeneration. Often it will occur from about 6 weeks onwards, but it can take several months before you see any signs of aberrant regeneration. And to the right here, I've given you one other patient with aberrant regeneration. In this instance, we have a patient who's looking into left gaze, and we can see that the palpable fissure of the right eye, which is that which had the third nerve palsy, is now wider on left gaze. So we have oculomotor synkinesis here, where we have elevation of the upper lid whilst attempting to adduct. What's the implication of aberrant regeneration? Well, it makes surgical management complicated because now you have oculomotor synkinesis on top of the third nerve palsy. The other issue is that it can be quite uncosmetic. So depending on what the aberrant regeneration is that has developed, at times it can be, patients can be quite concerned about the cosmesis of their lids, particularly when they're elevating when they shouldn't be. So with aberrant regeneration, we monitor and we await stabilisation, before considering any surgical management. But unfortunately, the only thing that can be done, if something can be done, is surgery in these particular instances. So in summary, aberrant regeneration is a phenomenon that occurs in third nerve palsies and involves oculomotor synkinesis of either the extraocular muscles, lids, and or the pupil. And it most often occurs in patients who've had structural damage to the nerve rather than when they've had third nerve palsies, for instance, that have occurred due to microvascular events. Okay, that brings us to the conclusion of this video. Thank you for watching.